My name is Dr. Adam Fritsch. I'm a physical therapist. I've been a PT now for about 10 years, mostly practicing in outpatient orthopedics. So my background consists of, I graduated with my doctorate in clinical practice for physical therapy from Carroll University in 2011. And then I did an orthopedic residency in 2013. I'm also a fellow recognized by the American Academy of Orthopedic Manual Physical Therapists. So I'm fellowship trained as of 2018. We are musculoskeletal experts. So our jobs are to treat pretty much people from cradle to grave. And we're looking at trying to address any type of musculoskeletal impairment, any type of condition. So that could be anything like just general onset pain. It could be things like maybe deconditioning, maybe somebody's having some balance issues. We can also do things like do post-surgical stuff. So for example, if somebody's coming to have a surgery, that's like a knee replacement, hip replacement, maybe like a shoulder issue, rotator cuff repair, things like that. We can treat all those conditions. I think people oftentimes think that you just go see a physical therapist if you've had like a surgery or you've had some sort of an injury. And certainly we see those things and we see a lot of people for those issues. But anytime you're having any type of a problem, like just even a general onset pain condition, maybe you're having a little bit of knee issue or maybe a shoulder issue, hip issue, what have you, and there's something that you might want to see somebody to try to see if we can get that addressed. That's a perfect time to see a physical therapist. Even things too, for example, like maybe you're just having trouble, getting out of a chair, or maybe you're having trouble just, like hanging with your grandkids and picking them up, or throwing a ball with your son or daughter in the backyard. Those are all things a physical therapist can help you with. So in physical therapy, we have a lot of different specialties. So the main one that's probably one of the biggest is orthopedics, so general orthopedic conditions, again, kind of more in that musculoskeletal realm. But we also see people for neurological conditions as well too. So neuromuscular is another specialty that we'll see. So that might be things like somebody who's dealing with Parkinson's disease or MS or ALS. And then we also treat things like vestibular, so like dizziness and falls. And then we also see people that have maybe had an amputation and we need to show them how to use a prosthetic and have them try to walk again, or be able to kind of do transfers, getting up and out of chairs, things like that. We also see geriatrics, so people that are kind of over the age of 50, if you will. And then pediatrics, we treat kids, so again, anybody from an infant all the way up until kind of in their teens, and then moving forward from there, obviously more into the adult area. And then we also do things like we do lymphedema massage as well too. So we'll treat like lymphedema where somebody might be having a lot of swelling issues. Post cancer treatment is another big one as well too. So these are just kind of some of the areas that we'll treat as far as in the physical therapy realm, but those are just some of the specialties that we'll see. Physical therapy is so critical because 1 in 2 adults in this country are dealing with some sort of musculoskeletal pain. We also know that as of over the last couple of years, that up to 50% of individuals are dealing with some sort of a chronic pain issue. So I think that physical therapy, just from that standpoint, is super important. But the other issue too is that of those individuals, that 1 in 2 adults that have some sort of a pain problem, only about 10% utilize physical therapy and see physical therapy providers, which is just astounding. So we are the musculoskeletal pain experts. That is our job. That is kind of our niche, if you will. And so we need to be seeing these individuals. We need to be seeing these people because we can help them. We can help them get out of pain. But then going further, why not help them just have a better life? Why not get them back to doing things not only that they were doing before, but even previous to that? Let's get them better than they were before. Let's get them stronger. Let's get them healthier. Let's get them more fit. Physical activity and resistance-based training has been shown to reduce all-cause mortality by 23%, cancer mortality by 30%. This is stuff we can do. We can get you stronger, we can get you more fit, get you healthier, moving better, and get you to not only just be somebody that is living pain-free, but also just living a better life and just being a more resilient human being to just kind of get out there and do all the things that they want to be able to do.